All right, we're gonna do the shoulder special test. So in all our special tests, we're gonna make sure our patient's shoulders are neutral. I'm gonna move her hair. We are gonna start with the SE joint stability test. So what you're gonna do is you're gonna palpate clavicle all the way to that medial sternum. You're gonna grab the clavicle and you're gonna move that up and down. You're looking for laxity. That's for an SC sprain. And if you take that clavicle all the way to the lateral side, you're gonna find the AC joint. And you're gonna find the distal clavicle. You're gonna grab it and you're gonna move it up and down. You're looking for laxity. That's for an AC joint sprain or AC ligament sprain. I have what's called the load and shift test. So what I'm gonna do is I'm gonna put my hand up here, like clavicle scapula, and I'm gonna grab the humeral head. And I'm gonna move that humeral head forward and back and see if it's coming out. You're looking for laxity or pain. And that is gonna be for a labral tear or a GH ligament sprain because the head of the humerus is coming out. Next, we're gonna do sulcus sign. So I'm putting my hand here, I'm grabbing just below the humeral head, and I'm pulling down. I'm trying to create a sulcus, which is like gapping. If the gapping is at the AC joint, it could be an AC sprain. Or if it's at the GH joint, so like glenohumeral joint, that can be a glenohumeral sprain. So it depends on where that gapping is. Then I have the Neers test. The Neers test is you're gonna go near their ear. So I'm gonna passively flex and then adduct the arm, and you're going near their ear. And you're looking for pain, and that's for impingement of the supraspinatus, the long head of the biceps, or the subacromial bursa. So that's Neers test. Then after that, I have Hawkins-Kennedy. So kind of go into this horizontal internal rotation, and you're gonna internally rotate, and then you're gonna adduct across their body. And that, again, you're looking for pain, and it's for impingement, bicipital tendon, supraspinatus, or subacromial bursa. Then I have drop arm test. So I'm gonna take my patient's arm, I'm going to abduct it all the way to the top, and then I am going to let go and ask them to slowly let their arm down to their side. And I'm gonna make sure I'm ready to catch it in case it drops. If it drops, that is a rotator cuff strain. Then I have Jurgensen's test, your boy Jurgi. You're gonna go to shake your patient's hand. You're gonna make sure their elbow is at their side, and you're gonna tell them to pull their hand apart. So she's gonna go that way, I'm gonna go that way. And you're trying to do resisted supination. So one more time, we're going there. Alternatively, you can go here and have them try to push up, but I like the reverse handshake. And Jurgensen's, you're looking for pain or weakness, and that's for a bicep tendinopathy. Then we have Speed's test. So you're gonna have your patient right here in the front. You are going to resist on their forearm, and they're gonna lift up to the sky. And that, again, you're looking for pain or weakness. That is also for a bicep tendinopathy. After that, we have Ludington's test. So they're gonna put their hands on their head like this. You're gonna take 2 fingers, and you're gonna push down while they try to pull up. And you're looking for pain or weakness, and that, again, is bicep tendinopathy. Then we have the Adson test. So what you are going to do is have your patient stand up. You're gonna find your patient's distal pulse. You're gonna slightly put their arm into extension, and it's Adson, so she's gonna add her head to her arm. And you're looking for a change in pulse, numbness, tingling, or a color change. And that's for thoracic outlet syndrome. Sit back down. Next, we have Allen's test. Ugh, Allen. So you're gonna take their hand, you're gonna go into horizontal external rotation like this. You're gonna take their pulse, and they're gonna look that way. And you're looking for a change in the pulse, or you're looking for the color change, you're looking for like symptoms of radiating pain, and that's all gonna be for thoracic outlet syndrome. Then next, we have the military brace test. So our patient's gonna stand up. You are going to put both of their arms into extension. You're gonna find their pulse again. They're gonna look up to the sky. You're looking for changes in the pulse. You're looking for their hand to go numb. You're looking for any kind of color changes. And that's also for TOS. Next one, last one for TOS is we're gonna have our patient hands in the sky like this. They're gonna open and close their hands. This is called Ruse test. It's gonna be for 3 minutes. You're looking for tingling, numbness, color change, and it's for TOS. Great. Now I have O'Brien's test. O'Brien's test, you're gonna make them thumbs down straight in front of them. Then you are going to resist the patient's flexing, and they're gonna be painful. Then you're gonna have them flip their hands over, and you're gonna resist them flexing again. Generally, the pain will go away, and that's for a GH capsule injury or for a labral tear. And then I'm gonna have the apprehension relocation test. So I'm gonna have you put your feet on this side and head over here. You are going to have your patient all the way at the side of the table, and you are going to have them into like horizontal external rotation. What you're gonna do is grab their like humerus and their forearm, and you're gonna externally rotate them. They're gonna be like, oh my gosh, that's apprehensive, I don't like that. When they do that, then you're gonna do the relocation part. So you're gonna leave your hand on the forearm, you're gonna take your hand and you're gonna put it on the humeral head, and they're gonna be like, oh my gosh, that feels better. That is what's positive. So pain with this motion, that gets resolved with apprehension, and that's for a GH sprain or a labral tear. And then the last test, if you can flip right around for me, is going to be the adduction test. So I'm going to take their hand and I'm going to passively adduct it across their body. They're going to have pain at the AC joint, and that's for an AC joint sprain. Thanks.